In the December 24th issue of Jack, kind of the holiday gift for everybody this year is a supplement on updates in pulmonary hypertension. And the supplement to Jack is going to be featuring many papers, including the one that we're talking about right now on PAH Epidemiology and Registries. I'm with Professor Marc Humbert, Director of INSERM U999, and Vice Chairman of the National Reference Center for Pulmonary Hypertension, South Paris University. All right, let's start first with INSERM U999. What is that?
Yeah, that's a secret code. But INSERM means National Institute of Health, if you wish, and we have laboratories which have a number. So my number is 999. I did pay for that, maybe, but it's a good number.
It is. And so you collect data on?
On pulmonary hypertension. In fact, it is the only laboratory in my country devoted exclusively to pulmonary hypertension.
What's the epidemiology first? What are the numbers we're talking about?
Yeah, we are dealing with what is supposed to be a rare disease, but in fact, the classification of pulmonary hypertension does not describe a single condition, but several variants characterized by increased pulmonary artery pressure. And indeed, the group 1 of pulmonary hypertension, what we call pulmonary arterial hypertension, is rather rare. It is the prevalence is about 15 to 50 per million, so it's rather rare. But there are other groups like group 2, pulmonary hypertension due to left heart disease, which is quite common. Group 3, pulmonary hypertension due to chronic respiratory diseases, which is quite common. Group 4, chronic thromboembolic pulmonary hypertension, which is quite rare, but not that rare, in fact.
Now, in terms of what you're talking about in the paper, you're looking at registries. Can we get an idea first of how many people are in the registry there in France?
Yeah, no, it's first a very good news to have a chapter on registries. It's the first time, this is the 5th World Conference on Pulmonary Hypertension. It's the first time that we have an entire working group devoted to epidemiology and registries. So that's good news, yeah. It means that we have progressed a lot. Yeah. In fact, historically, the best registry ever was the NIH registry, which was made in the 1980s and published in the 1990s. And since then, there were very few registries until the early 2000s. And the French registry was one of the very first to organize itself in a very structured fashion. And now we have several thousands of patients in the French registry. We have more than 6,000 patients. But the very first paper we published in 2006 was describing only 674 patients. So such low numbers were already quite informative.
So it's getting easier to do studies.
It is much easier to do studies and to have real-life information.
What have we learned from the registries?
We have learned a lot. First, we have learned that the epidemiology is changing. In the 1980s, most patients were young females with unexplained shortness of breath and no comorbidities or very specific comorbidities like scleroderma, portal hypertension, or even exposure to appetite suppressant drugs. Now we see that the population is aging with more classic cardiology comorbidities. And it's quite interesting to see that the patients' populations are changing a bit. So this is quite important, certainly in part because of better awareness and more simple diagnostic tools like echo leading to right at cath when pulmonary hypertension is possible.
Now, in the United States, we have a study that was just published, SAFE PCI, that was actually a randomized study done through an NCDR registry. Over at the ESC meeting, there was a randomized trial that was using registry data for the first time. Are you going to be able to use registry data to actually start randomizing some patients into clinical trials?
Yeah, that might be the final aim. We have not done it yet, but for instance, on chronic thromboembolic pulmonary hypertension, which is a subgroup of pulmonary hypertension which can be cured by surgery, a small group of patients are not surgical candidates. And certainly the registries help to identify these patients and maybe in turn to propose them to be randomized in the randomized control trials. But it's not headline news right now.
What's the message you'd like to get out to people who treat pulmonary artery hypertension or who will see patients?
Yeah, no. First, the message is a lot of hope. We have done outstanding improvements in management of these patients. Not only treatment, but also early identification, better characterization of severity, better understanding of outcomes, and we know certainly better how to treat patients first line with a given drug or another one, or even sometimes with combination of drugs. So I think the first message is we have learned a lot, we have improved a lot. 20 years ago, our condition, pulmonary hypertension, was an orphan disease. Now it's only a rare disease. So we have drugs, we have very good centers in the US, in Europe, even in the developing countries. So things are progressing very well. And now we have more and more drugs. Of course, complexity is increasing because the diversity of drug offer is a challenge, in fact. But this number of drugs allows us to have more refined approaches. So I think broadly the news are excellent. We are doing well, and I hope that the patients will be treated in a better fashion. We have very good patient organizations like the PHA in the US or the French HTAP France or the PHA Europe group. So we have lots of patient organization, and the communication is doing well, and also the communication with basic science. So a very nice circle with industry, with patients, and with basic and clinical research.
We have a cover story, too, in CardioSource World News that I would like to direct you to, because it is really kind of exciting what they're doing with registry data and randomized trials within registries. So check that out. And Professor Humbert and the rest of the supplement to the December 24th issue of JACC, please go there for information, the latest that you can find on pulmonary arterial hypertension for CardioSource World News. I'm Executive Editor Rick McGuire.